Hi, it's Dr. Centeno, and I'm going to talk to you about the Interventional Orthopedics Mini Fellowship Program and why this is really unique. So, the first thing is this isn't just a job, but this is a movement to fix orthopedic spine and joint care. If you've ever been frustrated to see a patient who has been horribly and aggressively operated on and who got much worse and whose life is changed permanently for the worst, you know what I'm talking about. Our goal here, again, is to fix orthopedic care. So this isn't a job. It's a movement. It's a different way of viewing patients. So what are the advantages of being a Regenxx partner physician? Because at the end of the day, that's what we're talking about. The mini fellowship leads to a position with Centeno-Schultz Clinic and Regenexx. So where in the country you want to practice is up to you. Again, you're a Centeno-Schultz Clinic doc. Our training in Regen Med is second to none. There's no one else out there who's even a close second in our expertise. We've been doing this longer than anyone else in the U.S. There's no one, again, who has been doing it even within 5 years of when we started this. And you leave running the practice to us. We have ongoing CME, profit sharing, a stock option program, etc. So what is Regenxx? We're a medical group of advanced interventional orthopedics practitioners. We have 30-some sites around the country that all use a flexible lab platform. And we use that platform because our goal is deploying the world's most advanced and up-to-date biologics. So we have to use that flexible lab platform if we want to do that. So what's our history? Well, we began using stem cells in 2005, about 11 years ago here in 2016. And we're the most published authors in terms of N, meaning the number of patients published in the literature on the clinical use of stem cells to treat orthopedic conditions. And we have the largest orthopedic-focused Regen Med group practice in the world right now. So what is interventional orthopedics? It's the ability to really be a huge game changer, to precisely place biologics like advanced platelet products and stem cells into any joint in the human musculoskeletal system, from C0, C1 to the tibio-talar joint in the foot and ankle, any ligament, any tendon, or bone. Again, all under precise guidance. How does this compare to other fields? Well, obviously, it's much less invasive than surgical orthopedics, and our goal over the next 2 decades is to replace most of surgical orthopedics with procedures that are done with innovative biologics through a needle. At the same time, it's different from what's out there with regard to what's called sports and spine. Sports generally are doctors that have injected peripheral joints, used ultrasound. Spine are doctors who use usually fluoroscopy to inject the spine, and usually the two don't intersect. In our world here, we need them to intersect. We need every doctor to understand how to use fluoroscopy in the spine, how to use ultrasound in the peripheral joints at an advanced level. So again, our treatment is on this emerging field of regenerative medicine, which we believe is going to replace everything that we're currently doing. We offer a 1-year full fellowship program, which has a lab and/or a clinical research component, and then a 3-month mini fellowship that leads to a job, and that's what we're talking about here today. So what are the base qualifications for these programs? Our perfect candidate is a physical medicine or rehab, or sometimes a primary care sports medicine doc. For both, the candidate has to have extensive or reasonable levels of interventional spine experience. And for all intents and purposes, the candidate already has experience in spine interventions. Now, we have accepted a few qualified candidates who don't meet this criteria, who are advanced in musculoskeletal ultrasound and peripheral joints, and we've trained the opposite way as well, i.e. towards the spine. Our mini fellowship is located in really one of the prettiest spots in the United States, just outside of Boulder, Colorado, at the Centeno-Schultz Clinic. Our facility there is really second to none in the United States and frankly in the world. We have a large medical practice, 4 in-office ORs with 3 fluoro units and 4 advanced ultrasound units. We also work out of a outpatient surgery center with additional capacity. A large clean room biologic processing facility with 3 full-time staff, a fully equipped in-office stem cell research facility that's pretty much identical to that you would find in a university, 4 full-time physicians and 2 one-year fellows annually, and really one of the busiest Regen Med practices in the U.S. There's really no one, again, here who's a close second when it comes to doing not only the number of cases we do in Regen Med, but also the level of advanced care we provide. One of the things that our existing mini fellows have said when they've come on is they've said, wow, I had no idea that you guys were doing things at this level. They have been blown away because they've been with some really advanced guys who have done some advanced things, but not with the depth and breadth that we do it at Centeno-Schultz. So 3-month mini fellowship details, basically it begins on the quarter, but that's flexible to fit your schedule. Pay is about $75,000 annually while you're going through training. Obviously, once you get out of training and you start your job, that goes up. This is a full-time clinical, and our perfect candidate is a PM&R residency program graduate who's already completed a spine fellowship, but we have gone the other way as well, i.e. train doctors who are advanced in musculoskeletal ultrasound in spine. So this is a training program leading to a job in regenerative medicine. You'll work in a state-of-the-art Regenxx-owned facility. You'll be joining the Centeno-Schultz physician group. The position is salary plus bonus plus profit sharing. And if you have a busy and you can create a busy regenerative medicine practice, and we will help you do that throughout, and we'll be responsible for the marketing and all of that, you can make $400,000 to $500,000 a year annually. Now realize that that's working about half as hard as your colleagues who will be seeing 30, 40 patients a day, barely keeping their head above water to earn that amount. You will be seeing 12, 13, 14 patients a day, leave the office rested, leave the office saying, hey, I gave really high quality care to everyone that walked through that door today. And you can't say that when you're seeing 30 patients a day in a high volume pain practice. It just isn't possible. We have opportunities all over the country. So that means that you can work where you want to work. If obviously it works for us and we need a site there, and obviously it works for you. We'd much rather have someone who's happy to live in city X and who's qualified than try to fit a round peg into a square hole. Profit sharing means that you'll be rewarded for years' work by getting a share of the clinic profit, and you'll continue to advance your regenerative medicine knowledge as trends develop. So this is actually a graph here from our knee microenvironment study showing how we're starting to measure 25 cytokines and growth factors in the knee synovial fluid so that we can very accurately predict, based on that microenvironment, who's going to respond and who isn't, and then eventually be able to change that microenvironment like a farmer fertilizing the soil to make sure that his seeds grow. Again, way beyond where anyone else is doing anything in regenerative medicine these days. Most docs doing this work are taking a weekend course and calling it good. That's not what this is. This is being a player in regenerative medicine, not a follower, a leader. So frequently asked questions. When I learn Regen Med on the job, if I just take a pain position with a group or a hospital, no, you won't, because the bottom line is this is a cash and carry type practice. It's going to be for most of your career. So you're going to be able to do a couple cases here, a couple cases there. You will be a jack of all trades and a master of none. Can I do Regen Med if I take that hospital job? Again, please see above. Regen or Regenxx is a cash practice. Is that a good idea for the future? Absolutely. Insurance is going to hell in a handbasket. There's no doubt about that. Our medical care system is changing. Our focus is on helping you build that cash practice so no matter what happens, you're prepared. As an example, with Obamacare, we have seen copays and deductibles go through the roof. That means that in most medical practices right now, it's February. They're hearing crickets because patients don't want to come in yet and pay that new copay and deductible at the beginning of the year. That hasn't happened in our Regenxx practices because they're cash practices. How hard is it to inject a knee or a hip? I kind of did some of that in residency. We're not talking about just putting a needle inside a joint. We're talking about targeting precise structures in that joint using multiple imaging modalities. It is several levels above what you've done to date. What's there to know about Regen Med that I can't learn in a weekend course? After all, there's all these guys teaching these things. These guys say they're experts. A, they're not experts. And B, more importantly, again, as our mini fellows have found out, when they come into this mini fellowship, they are learning advanced skills that are light years beyond their colleagues. So in summary, this is a unique opportunity to be part of a movement to reinvent orthopedic care from the ground up. You will learn regenerative interventional orthopedics from world leaders and join the world's largest group practice that specializes specifically in this area. You'll get in on the ground floor of a movement that 20 years from now, you're going to kick yourself because you're going to say, you know what, I never really learned that stuff that well. And all these young guys are sailing past me because they're getting that stuff in their training. I should have gotten that training a long time ago. And you'll earn good money while taking the time to deliver high quality care. And more important than all of this is, again, this is a movement. We are reinventing orthopedic care here. Our goal is to change the world, not just to give you a job. So thanks, and please consider this opportunity.